Well, 3 years after the start of COVID-19, a new study is now looking at how babies that were born during the early days of the pandemic are doing.
Yeah, the study out of Ireland says these little ones could be experiencing a gap in communication skills. And here to tell us why is Dr. Kristen Anderson. She joins us from Kansas City University. Dr. Anderson, great to have you back on the show. Good to see you.
Good to see you guys. Thank you.
So, Dr. Christian, why are kids who were born around the start of the pandemic so heavily impacted here?
Yeah, so I think this was a really interesting study because it overall did find statistically significant evidence that these kids may have a deficiency in communication and not in other areas of development. But I think the important part is that it actually says the majority of pandemic-born babies had entirely normal communication scores. And I think that that's huge. This study looked at kids at 2 years of age, so maybe a little bit of catch-up time, between when they were born in that initial year and now. But I think it'll be really interesting to kind of see what we continue to see out of this population.
And Dr. Anderson, it sounds as though the biggest issue we are seeing is the communication skills with the kids. How do you gauge communication skills, pre-pandemic versus what we're seeing now?
Sure. So this study used a standardized score called the Ages and Stages Questionnaire, which is something that we see used in the U.S. as well. There's various screening tools that different offices will use for these developmental scoring. But each time you come in for a well visit, we're assessing your baby. We're looking for these milestones, gross motor, fine motor, speech, to make sure that we're seeing it within a normal range.
On your level of concern, your own scale, like 1 to 10, as a pediatrician, what level of concern are you at with this latest study?
I think low. I think 2, 3. I think what we're seeing is that even if there's a lag, as long as we're catching it on time and getting these kids, plugged into the resources that they need, early intervention is key, and speech can be caught up with these early interventions.
And so what should parents at this point be looking for if they have toddlers at home? What can they be doing to help?
Yeah, so the biggest things for parents would be reading to your kids, talking to your kids, singing songs, that are going to encourage language, and then making sure that you're coming in for those routine physicals, even if it's not a vaccine visit, even if it's not a big visit, because that's how we catch these things early.
Dr. Kristen, this is it's child related, but it's not related to our discussion that we're having here right now. But I'm wondering your level of concern with the fall, as we get into the fall, into winter, about flu, RSV, those types of respiratory illnesses in children. I've read a couple of reports out there. Don't know if I necessarily believe them, but they say it's going to be kind of rough this year. What are you and your team members preparing for as you help patients?
Yeah, so last year was a pretty rough season for respiratory illnesses, and we tend to blame RSV, but really we can see bronchiolitis, which is that clinical picture where kids, maybe require oxygen and extra support from various respiratory illnesses. So we can see that with influenza, we can see it with COVID, you can see it with common cold viruses as well. And it's really hard to predict what that season's going to look like. We've kind of seen a trend of a longer season and an earlier start since COVID. So hoping for the best, but kind of preparing for the worst again, I think.
Okay. Dr. Kristen Anderson from Kansas City University, thank you for your time today.
Good to see you.
Have a good day. Thank you.